Thank you, Mr. Speaker.
The gentlelady is represented for 5 minutes.
Thank you very much. Mr. Speaker, I rise today to speak on the urgent issue of health care reform. Later, the Congressional Black Caucus, led by a great leader who does this every Monday night on behalf of the CBC, Congresswoman Marcia Fudge from Ohio, will be holding another special order on health reform. Although I won't be able to join my colleagues tonight, I did want to come to the floor and add my voice to the chorus of members from the Congressional Black Caucus who are calling for real health care reform now. I want to begin by commending my colleagues in the CBC, especially Congresswoman and Dr. Donna Christensen, who also is the second vice chair of the Congressional Black Caucus and chairs our Congressional Black Caucus Health Brain Trust. She has been leading the charge to address health and racial and ethnic disparities in health care. Together with Representative Danny Davis, who co-chairs the CBC's Health and Wellness Task Force, that two of them have developed a very important set of requirements to ensure that real health care reform becomes the order of the day. So I just want to thank them for their leadership and just know that the Congressional Black Caucus supports what they have put together with all of the input of the CBC. Let me just begin by just saying we have said over and over again that we want to ensure that there is a strong public health option linked to Medicare providers. This requirement must remain intact in the final bill. We believe that we must continue to work to get this done as quickly as possible. That means hopefully we can do this before we recess this week. The 47 million uninsured deserve this. This means, again, we must pass a bill this week before we adjourn for the August recess. The Congressional Black Caucus believes that a bill that is less than $1 trillion, that's completely paid for, that's budget neutral, would likely compromise many of the provisions that are important to the millions of un-Americans that are uninsured. This is unacceptable. We think the bill must be at least have a cost of $1 trillion. There's no reason to consider a bill less costly. The CBC stands firmly behind an original request that we made along with the Congressional Hispanic Caucus and the Congressional Asian Pacific American Caucus to include specific health disparity provisions from the Tri-Caucus bill, which I believe is H.R. 3090, the Health Equity and Accountability Act. We want these provisions in the final health reform bill. The Tri-Caucus has worked on a comprehensive bill to eliminate health disparities for the last 8 years. We believe that we have a very good bill, and we are pleased that many of the provisions in our health care reform bill are included now as it relates to health and ethnic and racial disparities. The CBC considers the provisions on children's health, prevention services, and mental health and substance abuse critical to this bill, and they should not be compromised in the final product. We must ensure that we guarantee true parity for mental health and comprehensive coverage, including dental and vision for kids. Also, the Congressional Black Caucus believes that the disproportionate share hospital payments should not be cut in an unnecessary attempt to reduce the costs of the overall health bill. Many hospitals who care for a large number of low-income patients or which serve as teaching hospitals depend on these DSH payments to help cover their operating costs. We shouldn't be penalizing these hospitals because ultimately they will affect their ability to provide access and care to low-income populations. And finally, the Congressional Black Caucus strongly believes that we can realize a host of savings from a variety of provisions in this bill. Whether or not the Congressional Budget Office agrees to evaluate and score these savings. As a caucus, we strongly recommend including a trigger in the final health care reform bill that would allow those savings to be used to replace current pay-fors and to add important services that were left out of the initial bill because of the failure to fully access and score the final cost. The bottom line is that expanding access to care and expanding the availability of preventive health services will cut costs, mind you, and save lives, and will be to the benefit of everyone. We shouldn't try and recapture those savings and use them to strengthen. Excuse me, we should try to recapture those savings and use them to strengthen the system. Last week, President Obama reminded us all of the important work that we must do, and we must do it now. We must reject claims that the cost of reforming health care in America is something our nation can't afford. To the contrary, if we fail to act, and if we fail to act now, we do so at the peril of the American people, particularly the 47 million who will continue to suffer. Thank you, Congresswoman Fudge, for your leadership.